Good morning, students. Today we will study about reproductive health. Reproductive health refers to the healthy reproductive organ with normal function. It is a state of complete physical, mental, and social well being, and not merely the absence of reproductive disease. It deals with the reproductive processes, function, and system at all stage of life. Reproductive health problem and strategies. Reproductive health means a total well-being in all aspects of reproduction. India initiated reproductive health program in 1951. According to WHO, reproductive health means a total well being in all aspects of reproduction, that is, physical, emotional, behavioral, and social. A society is reproductively healthy if its people possess physical and functionally normal reproductive organ along with normal emotional and behavioral interactions. Now that program RCH, Reproductive and Healthcare Program, to aware people about reproductive related aspects to create a reproductively healthy society. What is the aim or and need of sex education in school? To provide right information about sex related aspects, to avoid sex related myth and misconceptions, proper information about reproductive organ, adolescence, and related changes, safe and hygienic sexual practices, sexual transmitted disease, AIDS, etc. Now, population explosion and birth control. Population explosion and birth control. In India, population was nearly 350 million during independence. It crossed 1 billion in May 2000. It means every sixth person in the world is an Indian. According to the census 2001, the population growth rate was still around 1.7%, that is 1 by 1000 per year, a rate at which our population would double in 33 years. So the rate is very high. Reason for population explosion: first is increased health facilities and better living condition due to the advancement in the technology. Health facilities improved so that death rate decline. A rapid decline in death rate, maternal mortality rate, infant mortality rate. This all due to the advancement in the medical, so that decline rate of death is declined, so that population reason, the reason behind that population explosion. Increase in number of people in reproductive age means that in India the majority of the population is young, means that they are at the age of reproductive age. Impact of population explosion: scarcity of basic requirement, food, shelter, clothing. What are the measures how we can control it? Motivate small family by using contraceptive method. Aware people about a slogan hum do hamare do, we too are too. Many couple have adopted a one child norm. Statutory rising of marriageable age of female to 18 year and that of male 21 year. All this will control the rate of increasing population. Ideal contraceptives, that contraceptive that will use user friendly, easily available, effective and reversible. No or least side effect. It should not interfere the sexual drive, desire or the sexual act of user. So it must be eco-friendly as well as easily available. It should not harm that person. Contraceptive methods. First is natural or traditional method, burial, utera, intrauterine devices, IUCDs, oral contraceptives, injectables, surgical method. Now, first is natural or traditional method. Avoid chance of ovum and sperm meeting. So, avoid fertilization. Periodic abstinence. Avoid coitus from day 10 to 17 of the menstrual cycle. This period is known as fertile period to prevent conception. Uh, Means that at that time, the rate of fertilization is chance of fertilization is very high. So avoid coitus during this period. Withdrawal or coitus interruption. Withdraw penis from vagina just before ejaculation to avoid insemination. By avoiding insemination just before ejaculation will it is a natural contraceptive. Lactational amora. It is the prevention of conception by breastfeeding the child. Ovulation and the cycle do not occur during the period of lactation. It has no side effect. This is effective up to 6 months following parturition. Chance of failure of this method are also very high. Thank you for today.